Okay, another Sunday night live. All right, I'm going to give you guys a minute to come on in. And if you are wondering why it looks so weird, is because I forgot my camera at my office, my webcam. So I am streaming through my phone, but I'm over here on the computer so that I can read my notes and so I can see the comments. So come on in. When you jump on in, make sure you hit the subscribe button and go ahead and share this out. I'm going to go ahead and give this a quick share out as well. And tonight's going to be good. There have been some crazy things that have happened in my practice this week, and they are too good not to tell. Now, I also realize that we are coming up to Thanksgiving here in the US, and I normally, around this time of year, will talk to you about how to protect yourselves from not overeating, how to make sure you're staying healthy through the holidays. And so, but I am going to put that on next week, because this particular topic today, it's 3 different patients, or actually 2 patients and a friend who I've had some experience with this particular week. And I'm like, whoa, these stories are too big to not tell. They're too big to not bring to light what is happening in the medical world, how these people have been neglected, and they're not the only ones. I mean, this is an epidemic of people not getting proper care. And then, of course, as a chiropractor, when you hear this story, you're going to be blown away by what these people were told in the medical industry, why they ended up with these health issues that they had. And they're all chiropractic cases, literally all of them. If not chiropractic, functional medicine, nutrition in some capacity. But medicine tends to take things and just twist them up because they don't have too many tools in their toolbox, and they think we're quacks. And you know, we're saving lives. We're literally saving lives. And I'm going to tell you about a woman today who, if you might be thinking, how does a chiropractor save somebody's life? I saved this woman's life, you guys. This is a crazy, crazy story. And it's just by asking the right questions, getting her the right diagnostics, and then being able to just manage her properly. So you're going to hear her story, and you're going to hear 2 more stories. And all of these are going to relate to what's happening in your world today for your health, your family's health, your future health. How do you protect yourself against not becoming a part of the system, a number in the system? So, hey, everybody, come on in. Jig'em Joe, nice to see you in here. Mad Dog, good to see you. 2%, how are you? Welcome in. And Peter Cooper, nice to see you. Hey, Lily, how are you, my dear? Always great to see you up here in the chat. So when you come on in, you guys just go ahead and make sure you're hitting the thumbs up button from whichever channel. We are streaming live to Facebook, YouTube on Dr. Paula Ruffin, DC, and it's all about the biology. And then, of course, Facebook over on Dr. Paula Ruffin, DC as well, and New Hudson Chiropractic. So we got 5 different places that you could be streaming in from. So when you come in, it would be awesome if you left a comment, asked a question. This is the place to ask questions. And when you leave comments and you engage like that, it shows more people the channel and what we're doing. So all right. So here we go. Welcome in to a Sunday night. All right, so I had 3 stories this week, and these stories they hit hard. So the first story is a good friend of mine that I grew up with. He's like my brother. I've known him since I was 14. And I saw him Friday night, and he told me he'd been in the hospital for a couple of days. And I said, what happened? And he's a year older than I am. And he said he ended up in the hospital. He went to go get his regular physical, his annual physical, and his doc took blood. He said he felt fine. He was a little tired, but no big deal. And then he went to go to get his annual physical. His doc sends him for blood work. The lab calls him and says, you need to go to the hospital right now. So he goes to the hospital. His platelets were like 16,000. Now they should be like over 150,000 and up. So they say, your platelets are low. Somewhere it's either your spleen, you're bleeding internally, something's going on. He has suffered from chronic migraines his whole life. So again, if this is sounding familiar to you, he's suffered from migraines his whole life. He does come in occasionally to get adjusted, but not regularly, but also has never, ever eaten well. He's the guy that hates vegetables and eats brownies all day long. And you can't get, you can't expect good health. You can't expect good things to happen. And I've been on him forever about getting himself together. And, he's overweight. He's got to lose weight. He plays hockey 3 times a week, but that's not enough. You can't outskate. You can't outrun an unhealthy diet. And so, his doctor said, you're lucky you didn't bleed out. If if you got hit really hard, he could have bled internally. So they got it under control. And he asks the question, do you think this has anything to do with my lifestyle? And the doctor says, are you ready? Here we go. Doctor says, no, this has absolutely nothing to do with lifestyle. This just happened. I'm here to tell you, your body doesn't just break. It doesn't just fucking break for no reason. Obviously, if you slip and fall and you break something, that's a whole different story. But you know what I'm talking about here. Your body just doesn't break. The body's will to survive, the body's ability to heal itself is so, so powerful until you put enough interference in front of it, and it just can't. And then you start getting things like this. Now, this is why a lot of people start to, they get these catastrophic health issues that brew under the surface. And then they get I have a friend of mine from, this happened to him last year, got a diagnosis of stage 4 lymphoma out of nowhere, super healthy guy. But what we ended up doing was we tested him for glyphosate Roundup, and he was toxic in Roundup. He's a farmer. So, the body will do its best to regulate the best it possibly can until there's so much interference that the interference just takes over. So I haven't talked, it was my daughter's 21st birthday party Friday night. So we were all at a family party with her, and, it wasn't the time or place to have that conversation with them, but I'll have that conversation with him this week sometime. I'll see him for the holidays. And, I just need to tell him, like, this was your wake up call. You're not doing people any favors by telling them, no, you've lived your life in a catastrophic way your whole life. And where you're ending up right now has nothing to do with how you've lived your life. You're not doing anyone any favors. You're not doing the family any favors, because you just, you got this guy, 60-year-old guy, young at heart, just needs to get it together and, just change his eating habits and start to live healthier. So, so it's interesting to me, where medicine just tends to think the body just breaks. The body just goes, oh yeah, no, the body doesn't do that. Body does not do that. The body heals itself until it can't, because something's interfering with its ability to heal. Sharpie Lover says, what are the units of platelet count? I don't know. You could Google that. Sometimes it's just units. I don't know. So it might be, yeah, I don't know. Because a platelet is a thing. And so it might just be the number of things. It could just be units. And then Sharpie Lover says, then what about cancer? And I don't know what that question means. Because I just talked about that. If people get, and the body can't just break. So when you say, yeah, the body can't just break. The body breaks, but it breaks for a reason. And that's the point, is that it doesn't just break for no reason, which was what my friend was told. No, your destructive eating habits. He doesn't drink, he doesn't smoke, anything like that, but he's very destructive in his eating habits. Your body can only take so much of that. So yeah, the body needs a reason to break. It doesn't just break. Thanks, Lily. Happy to, I know, 21st birthday to my little girl. I can't believe it, considering I don't feel 21 years older. So, hey, Ghetto Hippie, nice to see you in here. Thanks for coming in. Appreciate you being here. We got Mary Lou Lopez coming in over on Facebook. Welcome in, Mary Lou. Nice to see you. Make sure you hit the thumbs up button, hit that subscribe button from wherever you're coming in from. So, all right, so that's the first story. I'm going to save the story of the woman whose life I saved. I'm going to save that for last. So second story is I have a friend of mine that I know him from the gym, a very fit guy, former military, former police officer, takes a lot of, takes a lot of responsibility for his own health. And so he's, but he's had a lot of injuries because of his line of work, and he's had a lot of surgeries. So he's doing the best he can with what he's got, and he just tries to maintain a good, healthy lifestyle. Well, he ended up having a L4, L5 fusion somewhere down in his low back, had a fusion, and ended up with severe complications of pain. Now, there were no infections, no complications with the surgery itself. He went back, he had it checked, docs checked it, and they were like, no, I mean, surgery went great. Surgery's perfect. It's fine. And I saw him at the gym on Friday, I think it was. And he said he tried to walk on the treadmill and he couldn't even walk. And he's probably late 50s or so. So he's just in so much pain, like excruciating pain. He's unable to work. He can barely work out. So I started asking him, I said, listen, the severity of this, what happens is every time we get injured, we lose a little bit of our neurological balance and coordination. So our bodies kind of lose the sharpness, if you will, of how the nervous system functions, what it can detect, how it can heal, and how it manages pain. And so I said, you're in a neurological pain pattern. You're stuck in a pain pattern because your body doesn't know what the hell to do right now. It's a pretty severe surgery, but they say, they're like, as surgeries go, they say it's a pretty simple surgery is what they told him. And for him, it wasn't simple. There's stats on this stuff for a reason. So he can't get out of this pain pattern. And I said, your body is dysregulated. Your nervous system dysregulated. It doesn't know what to do. It's just firing off pain signals everywhere it can go because it's trying to get him to stop and slow down so it can try to heal, but it's wreaking havoc on him. So, and he's going through physical therapy. And I said, well, what kinds of things are they doing in PT? And he told me, and I said, let me show you a couple of things. So I had him get down on the floor. He said, I have a hard time getting down. He said, I can get down on the floor. I can't get up. And I said, don't worry, I'll help you. So get him down on the floor. And I showed him some, before I became a chiropractor, I worked in physical therapy for 5 years. I worked in orthopedic rehab. So I did all this stuff. So I showed him, I said, do they have you doing bird dogs, which is when you're on your hands and knees and you go opposite leg, opposite arm. But there's a very specific way that it needs to be done in order for you to change that neurological pathway. And what's powerful about it is that, so crawling is a reflex. Most people don't realize that. How do you think babies, learn how to crawl? It's a reflex. It's something our bodies just innately know how to do. And so babies start to crawl, and that actually develops the neurological pathway for walking. Okay, so think about that. And so, and of course, he's now walking really stiff, really tight. And this is what happens to a lot of people. And you know, maybe you might realize, okay, you don't walk as fluid as you once did. You could look at people and see that their arms don't swing, they're stiff in the hips. These people have lost a lot of this cross crawl pattern. So I said, listen, we got to, you know, get that cross crawl pattern back. And so I showed him how to do, what did I do with my camera there? Okay, sorry. I showed him how to do it. I showed him how I wanted to do it. Okay, there's a video on my page about how to do bird dogs properly. I think it's worth another video. But anyway, so I showed it to him, and then I had him get on his back, and I had him do pelvic tilts, which your feet are, knees are bent, your feet are on the ground, and you just slowly tilt the pelvis up, and you just hold tight through your core. Had him do that a few times, and then I had him get up, and he said, wow, that was actually a little bit easier. And I go, yeah, you're resetting your neurological pathway. And he said to me, you know, they told me that my neurological pathway, they said my brain's patterns are off. And so they gave me an injection of some drug, and they said that the drug would reset the neural pathways in his brain. And he had a severe reaction. It actually caused him more pain, caused him to go into a massive migraine headache. And I said, chiropractic does that. Chiropractic resets the nervous system. And I'm going to talk to you guys about some studies on chiropractic and how it actually legit resets the neurological pathways in the brain and the spinal cord without causing detrimental effects to people's health. So I told him, I said, you got to get into the office. Like, the only way to break this pathway is to get into the office and start getting under chiropractic care. Now, some of you are thinking, but he had a fusion. How are you going to do that? Chiropractors have tools, and I have specific tools that I use on people that are non-force. There's like some vibratory tools that I use, and it actually helps to stimulate the nervous system through vibration. And so I have worked with numerous people over the years who have had fusions in their neck, their low back, who've had rods in their spines for scoliosis. So there are ways, and that's really what we're looking at, is that we're not necessarily looking for the big crack. We're looking to help to create an impact in the nervous system so that it calms down, so that it resets its pathways properly, so this poor man can get out of pain, so the body can get back to a place of self-healing. So, so he's going to come in Monday. We're going to take good care of him. All right, that was story number 2. Okay, I had a comment here. Sharpie says, you're blaming people for their sicknesses. Many times this is the case, but that kind of umbrella generalization is absurd. Not blaming anybody. And my friend knows that he has terrible lifestyle habits. So who are you to blame? If you have terrible lifestyle habits and you get an illness that's lifestyle related, that is on you. So I'm not sitting here blaming anybody. I'm stating a fact. You want better health? Do better things for yourself. So yeah, I don't know what else you want me to say to that, Sharpie. That is the truth. Thanks for the thumbs up comment there, Lily. Appreciate that. Yes. Dang, hearing other stories. I'm pretty good shape. You are in great shape, Lily. You're doing good. And again, it's people who, you know, you have to make that commitment to yourself. You have to say, I want something better. If I know better, I have to do better. Mary Lou Lopez. Hi, Mary Lou. I've been thinking about you all last week, and I'm going to contact you tomorrow because I need to connect with you. She says, I probably need a pathway reset to get of my unbalanced sensation I've had for months. Yes, this was going to be my next suggestion. So Mary Lou has this, she feels unbalanced. Yeah, crazy. Can you imagine feeling like you've been on a cruise ship all day long? Yikes. So we will fix that, Mary Lou, for sure. It can always be worse. We should be grateful that it isn't. And, you know, I agree with that, ghetto hippie. And I think that there's there's definitely perspective in that you can say, yes, it could be worse. But your reality is your reality. And just because your reality isn't as bad as somebody else's, that's, I guess I want people to be grateful for where they're at. So that's the primary point of that. And then also to be able to say, yeah, I'm going to use that. Like it could be worse, but I'm going to make it better. Like, let's just make it better so that somebody else isn't looking at you and going, well, it could be worse. I could be ghetto hippie, So, and I look at, my life every single day is what can I do each and every day to be a better human, to be healthier in mind, body, and spirit? Can I be more loving? Can I be more kind? Can I show more gratitude? Can I, I don't know, like pick something. And I think that, again, we're talking about lifestyle, and mindset is a very big part of lifestyle. There are people who I know who are super active. They eat well, but then they're like miserable. They're depressed. They're angry. They're like not nice to be around. And, so it's kind of like you got to check yourself in all of the ways, I think. And Shawnee grows. It's so nice to see you here, dear. Have not seen you in forever. Hey, yeah, back to you. Thank you so much for being here. Appreciate you. How have you been? I did take the summer off if it makes you feel any better. So anyway, and P Squared, nice to see you, my friend. Popping in to say hi. I know it's like it's like OG Sunday night. Let's go. Yes. Lily says mindset makes a lot of difference in your health. I think, younger than my years, for sure. I think, yeah, being youthful in how you think and expressing joy, gratitude, being happy. And to go back to ghetto hippies, yeah, it could always be worse. Somebody asked me, this was years ago, and they said, do you ever have a bad day? And I said, I don't know. Like, I mean, I have varying shades of good. And yeah, there's like things that happen in my life that I'm like, well, that sucks. How am I going to deal with that? What do I need to do now? But the response to what happens in your life is far different than a reaction. And so if you can respond in a way that's healthy, if you can respond in a way that's calm, approach things in a different way rather than just reacting to all the shit that comes at you, that is the healthier way to then go, geez, do I have bad days? I had to think about it. I'm like, yeah, I mean, my dogs died, my parents died. I mean, like, shit happens, had a long-term relationship end, a couple years ago, like shit happens. Doesn't mean I wasn't affected by it, but how I think the level, the way you approach those things, the response versus the reaction, is also a measure of your resilience to come through all that stuff. And if you can have more resilience, you get through it better. You get through it, better neurologically. So Ghetto Hippie says, perspective and attitude truly matter. Yes, sir. Yes, mindset for sure. P Squared. So good to see you. Where's Kenny? We need Kenny in here. Okay, so here's the third story. And I'm going to share the third story with you. This is a woman whose life I think I saved. I'm saying I think I saved. But when I tell you the story, you're going to be like, wow, holy moly. And I'm going to tell you her story, and then I'm going to talk to you about like all the studies around chiropractic that relate back to all of these things. P Squared, I would text Kenny, but I'm on my phone because I forgot my camera. So that's why I look so funky. Lily says I'm still sassy, sexy, and savvy. That is why I love you.
And I agree. As her husband, she is all those things. Okay.
That's awesome. You are a lucky man. That's so great. Mary Lou says, I heard a message at church today about having an attitude of gratitude always. Yeah. Going to bed, you know, three things that you're grateful for, waking up in the morning, three things that you're grateful for. And, you know, sometimes you guys like, you know, when I went through that breakup, yeah, I was devastated, but I had to like whittle it down to, I had to whittle it down to small things of gratitude. You know, I had my health. I have clean water. You know, I mean, your gratitude list doesn't have to be anything huge, right? I mean, look around. Like, I live in a nice home. You know, it's not big. It's humble. It's mine. It's my house, right? It's like you just kind of look at. I have this love of a dog. I mean, your gratitude doesn't have to be a massive list. It's when you express gratitude, your neurology feels that. It's a huge part of healing. Who was that genie that popped up? I don't know. Oh,
That
that
was
genie.
me. The man behind the curtain.
Wait a minute. Let me hold on. Let me. You got to rub the bottle to get the genie up. Okay. So this woman came to see me a couple months ago. She's about 45. And she comes hobbling into my office, and she's got an issue going on with her knee. She had sprained her ankle. The Wizard of Oz. It was the Wizard of Oz. She had sprained her ankle back in June, I believe, June or July. And she came in, and the same ankle was swollen. And then she's got this issue going on with her knee. Sorry, just checking my phone there. For which she's in PT. She had cancer last year, and she went through chemo. Um, and then she had recently had an infusion. And so the oncologist had advised her to get this infusion and said that the chemo that you got, one of the side effects could be bone cancer. So we want you to get this infusion because this infusion might prevent bone cancer. Okay. So she goes in and she gets the infusion, immediately gets sick, and is like has like 3 weeks of severe flu-like symptoms. Crazy. And this happened right before she had come in to see me. She says it was like the worst flu I ever had. I know it was the infusion. I told my doctor. They said, no, there's no way that could affect. There's no way that could do that. And she's like, and I know it did. It happened right after I got it. I mean, what else would have done it? So then that's when the ankle swelled up again. And I was like, she goes, no, the ankle just swelled up for no reason. It happened right after I got the infusion, but I sprained the ankle back in June. And she said, so I think it just re-injured itself or something like that. So even she wasn't connecting some dots. And I go, your kidneys something's going on with your kidneys. And she goes, well, that's kind of what I thought, because I told the doctor, but they said, no, it couldn't have done it. So we're kind of having this conversation each and every time she comes in, and I'm like, okay. And I'm watching this swelling in her ankle, on her left ankle. And then she comes in last week and the right ankle's swollen. And I said, you need some blood work. Something's going on here. Your kidneys are struggling. Your liver's not clearing. Your lymphatic system is not draining. And I said, so we gotta do something. She says, okay. So she goes back to her doctor, and the doctor says, okay, we'll do blood work. We can get you in February. February, you guys. It's a cancer patient who's talking about how her body, she feels like she has the flu from an intervention that they told her she needed, and she now feels sicker than before she had cancer. And so she was just like, she goes, I don't know what to do. And I go, I'll order the labs. I order the labs. I hand her the sheet right then and there. I send her down the street to the lab the same day. not February. So she goes and she gets the labs. Now, in the meantime, also, I'm thinking she's been in physical therapy for a couple of months for this knee. No one, no one seems to care that she has this random swelling in her ankles. Like this, and this is where the medical system infuriates me, is that she's in PT for her knee, and guess what she is to PT? She's a knee. That's all she is a knee. No one is looking at her whole body. No one cares about the ankles, as long as we're just focusing on the knee, because that's how insurance works. Because when you're dictated by that, you can't be concerned about anything else because you won't get paid for it. So it's pretty crazy. So I get her labs back. Now, normally it takes me a little while to evaluate labs. And I looked at these. I scroll. It was red. Okay, let's just say red is bad. The whole thing. It was like crazy. And her iron was so low, it was like dangerously low. So her blood, her red blood cells were not getting iron. They weren't getting oxygenated. And her liver function, her liver numbers were way off. Her kidney numbers were way off. Her thyroid was in the tank, like everything. Her CRP, which is a measure of inflammation, off the charts. So her inflammatory marker was just insane. And I was like, this is an emergency room visit. These are dangerous numbers. So I sent her an email on Friday morning when I got the results on Saturday. And I sent her an email and I said, you need to go to the ER. Here's why. And I broke it down and I just did a general overview of the labs. And that's what I came up with. Like, I didn't even need to take a deeper dive, but that's the kind of thing. So when I say, chiropractic is, can help so many people, that is out of my scope. That is way out of my scope. So I practice functional medicine. I can help with nutrition. I can help with hormone balancing, but you get me a lab like that, and that's a referral out. And that's where we shine as chiropractors, because we have to be able to know what is in our league and what is outside of our league. But see, here's the beauty of it, is that I also, because I know that, I'm like, we need labs to see what's going on. Now I've looked at them, and now she can go back to her doctor and say, what the hell? Like, they weren't going to look at her until friggin' February. You guys, what would you have done if that was your wife or your sister or your mother? What, what would that look like? Do you think we're being well cared for in our medical system when we dismiss people like that? And she's like, they're like, absolutely not. That couldn't have caused that. I'm like, I'm still blown away by her. And I haven't heard from her. I told her, gave her my cell phone number. I said, please make sure you message me. I want to know what happens. I haven't heard from her. So I will definitely be calling her tomorrow. But this is when I say we save lives, because we have this ability to know what's what and when things need to do, when we need to send people where and when we don't. But I'll keep you guys posted on her, because that's a pretty interesting case. And yeah, ghetto hippie, definitely a toxic reaction. And like I said, her doctors had dismissed her. They're like, no, that couldn't have done it. And I looked it up. I was like, what's the name of that drug? And I looked it up when she was there, and I go, it says kidney failure. Like, that's it's like the number one thing on the list. Why wouldn't you pay attention to that? Rick, nice to see you, my friend. Oh my goodness, long time no see. Look at all these people, OGs from Sunday night. Ghetto hippie, yes, her body was struggling to detoxify, and you can see that in her liver numbers and her kidney numbers for sure. And it is a disgrace in how people are pushed off. And again, you think about this, like if it was one of your own loved ones, that's not, if it was you or if it was a loved one. No one wants to be treated like that. No one wants to be looked at as a piece and a part. And then also, like, this whole thing about that, let's give you an infusion because the chemo might cause cancer. So put the fear of God in her, that the chemo would cause bone cancer down the road. So here's the chemo. going to help her with the breast cancer, but it's going to cause bone cancer. Like it's so effing backwards. And so we're going to give you this other infusion that might prevent bone cancer, but can cause kidney failure. Well, you're dead anyway. Like, I mean, it's crazy. And this is why I'm here, because I need to bring a bit of the insanity and have these open conversations, because I don't know that, I think if it happens to you, if something like this happened to you, to most people, if you're scared, you're going to listen to them, and it's going to be very challenging to make sound, rational decisions out of fear. And this is one thing you're going to see with chiropractic care is it actually improves the frontal cortex of the brain. And this is where this is your critical thinking and your sound decision making part of your brain. So how cool is that? So, even if you did have some sort of cancer or some other serious illness, wouldn't you want to be able to make sure that your nervous system was able to make the most sound, critical decisions? I mean, yeah, because it is scary. It's a really scary diagnosis. And at that point, my opinion on cancer or something like that is like, you want all hands on deck. Like you've got oncologists telling people, I would say to a patient, all right, listen, in fact, this cancer patient I was just talking about, I'm like, I need to have you on something for your liver and her kidneys. Like I got her on stuff to support her metabolic system, but it's going to be a long time because, this was a long time coming. But it'll be a long time before it's healing. So she's on good stuff, but it's not going to, it's not going to outweigh what she's got going on right now. Like, I don't know what intervention needs to take place, but something does. But I was on a path to a thought and I completely forgot. I'll think of it in a minute. So we'll go to the chat. Let's do that. Okay. Ghetto Hippie says, this is the effect of profits over patient. Sure is, isn't it? Yeah. Yeah. So I'm here to do the right thing. I tell people, gosh, I had a patient come in and he didn't come regularly. And again, he was very metabolically unfit. And I was trying to talk to him about nutrition. He wanted to get better. He wanted to lose weight. He wanted all the things, but he wasn't willing to do the work. So he comes in, he's complaining about his pain again. I send him to a friend of mine who does decompression, spinal decompression. It's kind of like traction. So I send him to him, and the guy comes back and he says, he goes, you sent me to another chiropractor. Like he was almost mad at me. And I go, yeah. And he goes, I thought you were sending me to a decompression specialist. I go, I did. He's a chiropractor. And he goes, well, he could steal me as your patient. And I go, if he helps you and you decide you want to continue care with him, go. Like if that's what helped you, but also this colleague of mine, this friend of mine, we have shared many, many patients over the years because he does certain things I don't. And our patients will see both of us in tandem because we are both doing something unique, but it's helping together for the betterment of the patient. So I don't care. It's better for you to go. So he's going to send me somebody. They might think the same thing, but I'm like, I don't think of it like that. So, yeah, anywho, let me go back to this question. P Square says, yes, the PT will tell you they cannot focus on anything but the issue they walked in with. Yep. So true. You are what you are. And they intentionally keep the number of doctors down to create a shortage to cause artificial inflation in price. Which is interesting. I don't know about that. I had not heard that, so I don't know if that's true or not. But the insurance companies are certainly dictating prices, and you know, people ask me, they're like, you know, do you accept insurance? And I'm like, not really. You know, insurance wants to pay you very little money. And, you know, going back to this woman whose labs that I just took her labs, to me, that's priceless. What I did for her was priceless. I mean, I have to put a value on it, but it's priceless. I saved her freaking life. I mean, like, think about that. And insurance wants to pay me $28? No, no. Mm-mm. Lily says, my mother, who was fainting and hitting her head often, had doctors puzzled. It took me to ask her what she was taking her meds with. Grapefruit juice. That was the problem, was affecting her meds, right? And they always say, don't take it with grapefruit juice, right? Yeah. Uh, I stay away from the medical mafia. And you know what, ghetto hippie, this is what I tell people. And this is why I love to do these shows, because if you can stay out of the system, if I can give you something, if I can give you some morsel of something that helps a shift, if you're already thinking you're super healthy, but then you're like, I mean, don't forget, we're surrounded by crap in our air. I went outside today and I'd not seen this over my own personal head. I wish I could figure out how to share that. I don't know if I could share my phone screen. I doubt it. No, I can't. Okay. And now I don't even know how to go back now. Let's see. Come on, go back. Edit audio. Okay, there we go. I'm back. Um, and there were 10 or more lines straight across the sky, and 3 more planes coming behind it, one here, one behind it, one, and they filled the sky with these lines. And a friend of mine posted on Facebook a little while later, he said, cool clouds in the sky. And I'm like, you're not seriously looking at that thinking that God made those clouds, right? Like they're so man-made. So this is, you know, the shit that's in our air all the time. So regardless of how healthy you think you are, we always have to be doing more for ourselves because of that. Like, I don't know what's in that. Holy crap. That was, and it's all, I don't even know. I don't even know what to think about that. I mean, I know what to think about it, and I have lots of thoughts, but it's going to involve a lot of profanity. Prayers that she got the help she needs. Yes, thank you, P Squared. I appreciate it. And P Squared said, you look great, Dr. I have to run. Thanks, P Squared. Good to see you again. I love you. Hope to see you soon. It's support that your body needs to heal while it's fighting for its life. Yeah, so that's like, I was, you know, this woman she needs something. She needs something. And so I got her on some really good, powerful nutrients to help her body clear whatever this is that she's got going on. So Shawnee Groves says it takes time. I've been on a healing journey for 4 years. I'm just now seeing iron levels normal. Heading into winter, my vitamin D drops. So now I'm back on that. Cortisol levels and adrenals need help. Yes. So actually, I talked about that. I think we talked about D last Sunday. It was either there or on Chiropractic is Sexy. I can't remember, but good for you. And that's the thing, you know, staying the course, because so many people will spend 2, 3, 4 months and they're like, it's not working. And then they become jumpers, right? They jump from one person to the next because they're not getting the answers that they want, when really the answer is just commitment, dedication, consistency, all of that. So bravo to you, Shawnee, for sticking with it. It is. It's like, it's never ending. People need easier access to blood labs to be able to check any time of the year. Absolutely. I mean, if anybody wants me to order a lab for them, you can reach out and we can get some labs ordered. So I can work with you virtually. I work with LabCorp. They're all around the country. And I don't know if they're in Canada also, but yeah, it's easy. I write the order, you go the next day, make an appointment, whatever, and I get results within 48 hours. Like, it's not months. Let's see. And Lily says it does take time to heal. Yeah. Insurance is a scam. Boy, it sure is, isn't it? The only people making money off of insurance is the insurance companies. Shawnee says, all my homeopathic care has been out of pocket. Even testing your poop helps get to the bottom of things. Yep. So it's amazing. And that's the thing too. So this is actually a great comment. So let me comment on this. A lot of people who have GI issues, they'll go to the doctor, they'll do an upper GI. So they scope the upper, so tube down your throat into your stomach and the upper part of the intestines. And then they'll do a lower GI, so tube up your butt and then into the lower part of the intestines. And if they don't see anything, you're fine. Or they'll be like, oh, you might have a couple of polyps, something like that. You guys, you can't see microbes with a camera. You can't see microbes with a camera. So the poop testing that Shawnee is referring to is that's your gold standard, not a scope up your ass to tell you we found nothing and you're fine and you're crazy. So I do urine testing to check gut bacteria. That's actually my first line, and then I would go to fecal testing if I needed to. But yeah, super beneficial. Like it's crazy. Ghetto hippie. I've been studying chemtrails since the 1990s. Yeah. I know. So it's freaking crazy. Lily says, I'm into nutrient dense foods, doing my research and going to steer our diet towards healthier choices. Yes, ma'am. I know. So it was my daughter's birthday on Friday, and I wanted to get her a cake, but I didn't want to get just any cake. So then I was like, you know what? Carrot cake is always good. So I called around, couldn't find anything that didn't require like a 2-day order. And then my sister-in-law says, oh, Kroger has carrot cake, and Kroger's our local grocery store here in the Midwest. And I was like, I am not about to sign up for the hydrogenated oil. And I really wanted carrot cake. So I go, I got time. I'm going to make the carrot cake. So I made it, and it was all the freshest ingredients. It's all organic. I put organic unsweetened coconut in there. I put walnuts in it that come from a woman an hour away, and she has an English walnut orchard, and she hand cracks each and every one. Like it was so good. I made the cream cheese frosting like my mother would make it with that little bit of tartness. So freaking yummy. And a girlfriend of mine said, if you can take the time to make it, your body can take it, something like that, right? So if you make something like that and you put all that kind of love into it, you're not going to gorge on it. You're just, the couple of bites and you savor it. And so, yeah. So yes, I had birthday cake for my daughter. And personally, I think it was pretty nutrient dense because there was a ton of carrots and coconut and walnuts in there. So yeah. Let's see. Lily says LabCorp does not have a direct consumer presence in Canada for labs testing, but they have a global presence and a history of operating in Canada through acquisitions. Okay. So that means you can't use LabCorp. You can't just go into a LabCorp and get labs, right? And Ghetto Hippie says many people end up with crippling injuries from colonoscopies. Right. Yeah. I've been in practice 28 years. And I've had 3 people. Now, you think about how many people have I had that have had colonoscopies. I don't really know what that number is, but at 3 people that I know of that all had perforated colons from having a colonoscopy. And think about this. Let's go in every 4 or 5 years, have a tube shoved up your butt and tell you you're fine. Everything's fine. Come back in 5 years with nothing, with no lifestyle guidance, with nothing. And again, like you could be overweight, you could be a smoker, you could have autoimmune issues, you could have digestive issues, you could have all kinds of chronic health issues. You could be diabetic, you could have hypertension, like you could have some other metabolic disease, and the doctors are like, everything looks fine. Come back in 5 years. Nope. But going back to what Shawnee said, if you poop in a cup, that'll tell you a heck of a lot more than just going and getting a colonoscopy. So, Mad Dog, night night. Thanks so much for popping in. Appreciate you very much. We can't walk into a lab without a doctor requisition. Got it. Okay. Yeah. Yeah. Yeah, and we can get rid of that person. I don't know who that is. Da-da. I can't get rid of that on my end, Ken. Yeah, get rid of that. I don't know who that is. Right? Is it a
They're on Facebook, so yeah.
Okay. Usually when they say that kind of stuff, it's some kind of scam. All right, we'll let her hang out here for a second. Anyway. All right, so before we wrap up, so those were my 3 stories. But before we wrap up, I want to go through some of the things when we talk about these stories and what these people experienced when they went into the medical system, and how they were treated, how they were dismissed, how they were not well guided, right? So my friend, it's like, no, his doctor needed to say to him, yes, this is because of the lifestyle. Now, also because he's had migraine headaches, he's taken Advil, Tylenol, there's actual like I forget what the names of the migraine medications are. He's taken some form of medication weekly, multiple times a week for years. That is going to wear away the mucosal lining for sure. So you can, again, not doing him any favors by saying, we can't do this. You got it. Yes, you have to change your diet. You have to, like, let's get real. It's okay to tell people. It is all about the biology. Yes. One more quick story that I just remembered. Another friend of mine is taking something for naproxen. Yeah, naproxen, it's pain, anti-inflammatory. Taking that for pain and inflammation, because she too has like some weird ankle and things going on. Former cancer patient, all of that. And I said, I don't need to tell you this. And I go, but just be careful. I know you're careful, but your gut, because she has digestive issues too. And I said, your gut can't afford the damage from that. And she was like, no, I appreciate it. And she said, but my doctor told me because I'm on the acid blocker. And I'm like, oh shit. I'm like, oh shit, here it comes. And she says, because I'm on the acid blocker, that provides a level of protection against the naproxen. And I go, how? And she goes, well, I don't know, but he said that it does. And I go, that makes no sense. The acid is your protection against like shit going south in your gut. And I think maybe that's another show that I need to, because if you don't have acid, you are at the mercy of microbes. Like you are not protected at all. Your mucosal lining is not protected. So again, very backwards thought process that the body doesn't need acid and acid's bad. You better have some acid in there if you want protection for your gut and for your health and for your microbes. So, all right, so here's what chiropractic does. And here's how chiropractic could help all these people, which the guy from the gym will be under care. Everybody else is under care. So adjustments restore proper input to the brain. That's what I was telling you. It helps to actually improve the prefrontal cortex, the brain stem, and it's like hitting the refresh button on your computer. So you're able to make clearer thoughts. It helps with foggy brain. It helps you make more sound decisions. Getting adjusted helps switch you out of fight or flight. So we're constantly running from that saber-toothed tiger. And when you get adjusted, it actually switches on the parasympathetic rest, digest, and repair part of your nervous system. So we can stop feeling chased by that tiger even for just a short bit. But usually people, after they get adjusted, they'll say that they feel a little more calm. They feel a little more grounded. They almost feel like they got a reset. Getting adjusted improves inflammation. So it reduces inflammation, it reduces blood flow, and it improves mitochondrial function. Your mitochondria are these little things inside your cell that provide you energy. It's where all your DNA, all your RNA is transcribed. It's where all your hormones are produced. And most people are struggling with chronic issues because they have poor mitochondrial function. So it improves oxygenation. So bringing the inflammatory process down improves healing. It creates more oxygen to the cell, so you get better movement. And of course, more oxygen inside the cell creates better mitochondrial output. So like fuels like. Now, this one I love because this is my friend from the gym. It restores normal movement patterns. And this is what I was telling him, is that injuries are stressors on the brain and the nervous system. And chiropractic actually helps to restore the input to the brain and the nervous system. So it restores the input so that the output can be better. So the output can be improved. And that's pretty cool. When you're thinking about, like, these are uh, bio, they call it biomodulation. So basically, like the joints, the proprioceptors inside the joint, and then how that all works together with your neurological pathways, your neurochemicals, they all come together in synergy. And so that helps to decrease pain. It helps to decrease inflammation, and it helps everything to start working more synergistically together. It's pretty freaking cool. Then the last thing that I have on my notes is that it improves immune coordination. So when the nervous system calms down, the immune system regulates. And there's actually been studies that show that T cell production, there's been a 48% increase in T cell production after people get adjusted, and it improves antibody production. So it's pretty freaking cool what chiropractic can do and how it can restore function for people and restore your lives. So it's more than just a rack 'em crack 'em. It's more than just a neck pain, back pain kind of a thing. It is next level. So think about that, next time and I think some people too, if they're in a lot of pain, and they'll be like, oh my God, I couldn't have anybody touch me right now, because you're thinking about the traditional adjustment, which could be perceived as painful if you're already in a lot of pain. But again, that's where a skilled chiropractor comes into place. Is like, we're not just like putting our hands on you and lighting into you. And we may just use these other tools that are low force, that use vibration, that will help to reset your nervous system. So there's definitely lots of ways naturally. The more medications you take, the more you get into that medical system, the more opportunity there is for side effects and further advancement of chronic issues. So Lily says Advil, Tylenol, bad for the liver. Yes, Tylenol is the number one reason for liver disease here in the United States. It's terrible. People believe that if they have acid reflux, it's too much acid. It's the opposite. They need more from my research. Lemon in water is good. Yes. Yeah. Lemon and Ghetto Hippie says vinegar. So I will put people on either a squeeze of lemon in their water or apple cider vinegar. And so what those do, so they are acid. So they go in and they support the stomach acid, but then they metabolize alkaline. So that's the cool thing. I remember talking to this woman, and she insisted, and there was some health guru somewhere along the way. And it was years ago. And I was like, that is the worst information you could have been given, to take a tablespoon of bicarbonate, baking soda, in water every morning. I go, why would you do that? And this like and I can't remember if it was like Dr. Gundry, if you guys know who Gundry is. Like, it was some like big name like that. And it may have even been Gundry. I can't remember. I don't want to implicate him if it wasn't him. But she said, well, no, because it's alkaline. And so you want to create more alkalinity in your body. And I go, that's not how that works. It creates more alkalinity in your stomach. It neutralizes your stomach acid, which you need to break down food, so that then the rest of your body can process the things it needs to process in a more alkaline way. Like, it's this is the dumbest thing I'd ever heard. But she was convinced. She's like, nope, I'm going to continue taking my baking soda every morning. I'm like, okay, you keep doing that. By the way, this is kombucha. Just FYI, if anybody's like, what is she drinking? Yes, I was going to say that it's acidic that goes alkaline in your body, which is what you want. Absolutely. Yeah. Yeah. So, learning all of these like metabolic things is pretty freaking cool. I get a charge out of it. I enjoy it. It's fascinating to me how the human body works. So, yes. And I hope you appreciate it too. I'm sure you guys do. Okay. So that's all I got for you. What questions do you have for me? And, if you have any questions, obviously you can always email me. You can reach out. You can leave a comment on the page. You can leave a comment down below here, and I do read my comments. I will respond. And yes, drruffin.com is where you can find me. And I think, yeah, this almost didn't happen tonight because I couldn't figure out how I was going to transmit my mug to here to my computer. So thanks, Ken. I figured it out, but I still threw up the Hail Mary to Ken. I was like, oh my God. So so here we are. So I'm gonna let you guys go. I'm gonna go decompress and get ready for my week. And I think that's about it. But I wanted to say thanks to everybody for being here. Make sure you're liking, sharing, subscribing, all the things from whatever channel you're coming in on. Please jump over to the other channels. If you're coming in from drruffin.com or Dr. Ruffin DC, jump over to It's All About the Biology, give them a subscribe. And if you're coming from It's All About the Biology, would you be so kind as to go to Dr. Paula Ruffin DC and give that page a subscribe as well? I would greatly appreciate it. So, all right, you guys, thank you so much. Appreciate each and every one of you. We'll see you next Sunday. There's no Chiropractic is Sexy this Thursday because it's American Thanksgiving. So, all right. See you guys soon. Have a great weekend. Have a great week. See ya.